which of the following is true about Pegfilgrastim, pegylated filgrastim. So what is the important thing to remember? Filgrastim, as the name tells us, it is a granulocyte stimulator. The name says it is a granulocyte colony stimulating factor. Now the main drug which is GCSF is filgrastim, as the name tells. But there is another drug called as pegylated filgrastim. So what is the difference between filgrastim and pegylated filgrastim is, pegylated filgrastim is containing PEG, which is polyethylene glycol, and this is added to the drugs to make them long acting. Like I commonly tell कि PEG लगा के आदमी लंबा चलता है, दवाई तो चली जाएगी. So pegylated drugs are long acting. So Pegfilgrastim is longer acting than filgrastim. One is clear. Okay. Now what is the controversy here is, it is contraindicated in patients with sickle cell anemia. So this is the controversy here. It is not a controversy. Actually, pegylated filgrastim as well as filgrastim, they can precipitate sickle cell crisis in these patients. So it is avoided or given very carefully because they can precipitate a crisis in these patients, but this is not a contraindication. So remember, you need to see this option very carefully. If any other option you can find is correct, mark that as an answer, because sickle cell anemia is not a contraindication. Pegylated filgrastim or filgrastims are avoided in sickle cell anemia, but they are not absolutely contraindicated. The other options, it can be given orally, is wrong. Remember, both of them are injectable. Then not effective in severe neutropenia is again wrong. Yes, they are used for neutropenia. That is their main use. So two options seem to be correct in this. One, it is longer acting, and second, it is contraindicated in sickle cell anemia. Be very careful. If both are correct, contraindication is not an absolute. So the right answer will be longer acting. Okay, so according to me, the answer to this question will be a longer acting, but you need to choose according to the options. Now I can show you the reference here. So this is the package in that of Pegfilgrastim, the paper which comes along with the drug itself. So that package in that is saying that fatal sickle cell crisis have occurred. That means it can cause sickle cell crisis, but from the same package insert, it is written later on in detail that severe and sometimes fatal sickle cell crisis can occur in patients with sickle cell disorder receiving Pegfilgrastim. Discontinue this if sickle cell crisis occurs. So that means clearly they are telling they can be used in sickle cell anemia, but whenever this crisis occurs, we need to stop them. So they should be given carefully. They are not contraindicated. Okay, so this controversy is also crushed, right?